So COVID-19's demands on our failing health system in Africa has interrupted programs for women and girls living with HIV. So let's discuss this with Aeneas Chuma, who is the interim director for UNAIDS in Eastern and Southern Africa. Mr. Chuma, thank you for your time on eNCA this evening. So the COVID-19 crisis and the response to it has arguably compounded gender inequality and harmful gender norms. How is this affected women and girls living with HIV?
I think it has affected women and girls in several ways, in many facets of their lives, in their well-being and their health. For example, we've noticed that there was limited access to health, for example, during the lockdown. And we've noticed now new cases of mental health afflictions as well. We've seen a rise in gender-based violence, especially intimate partner and sexual violence under conditions of the lockdown. And in particular, girls' education has been disrupted, in particular during the lockdown, and we've seen instances of teen pregnancies. So by and large, the impact of COVID really has been particularly severe on adolescent girls and young women, and women in general, and in particular those that are living with HIV.
So have countries in the Eastern and Southern Africa regions responded adequately to the needs of these women and girls during the pandemic?
Well, they have responded, but it's never enough. I think a lot more needs to be done, given the type of challenges that we face. During the wave one, the first wave of COVID, when all governments were grappling on how to respond, a lot of the responses were quite gender blind in that case. But since then, they've learned, and more recent strategies in responding to COVID-19 have been, gender sensitive. We've seen social protection. We've seen a lot more targeting of support for young women and elderly women as well. And in some cases, particularly for women on ARVs, they've been allowed to collect medications over several months, 3-4 months. I hope that it's longer than that, because historically these medications were collected on a monthly basis. So all these little demonstrate that there's a process of learning. There has been some response to try and improve the situation, but the point is that much more needs to be done in a concerted fashion.
And what more do you think can be done to promote and protect their right to health?
I think we could see a little more gender-sensitive response in all respects, and for women in all their diversity. That's one. And we also need to have much more targeted response to the needs of women and girls. It cannot be just a general response, as it were. And we see that there will be need for very specific sexual and reproductive health services being made available, being made accessible and strengthened to adolescent girls and young women in particular, and women in general. And of course, the idea of multi-month dispensing of medication, I think, should be institutionalized. It makes sense. It means that women don't have to leave home to go and line up for medication and travel and be subjected to abuse, as it were. And I think equally important, gender-based violence support services within the police services, the judiciary, need to be publicized, need to be made effective, need to be adequately resourced. So ultimately, I think what we should be aiming for is that women must feel safe, they must feel protected, and must feel supported within their own communities and within their families.
Yeah, and what this pandemic has really laid bare are the risks that we've ignored for decades, that inadequate health system. Yeah, thanks for your time, Aeneas Chuma.
Thank you very much indeed for your interest.
Yeah, thank you. Yeah.